Hi, a lot of patients ask me why I don't prescribe antibiotics more frequently. For example, back in the day, if you came to the dentist and you had a toothache, you would usually leave with 2 prescriptions, maybe even 3. You'd leave with a prescription for antibiotics, sometimes for a high dose of, Advil or Motrin, and sometimes even a narcotic. We do things quite a bit differently. I'm sure you've heard about how the opioid crisis has affected how we as dentists prescribe antibiotics. But other things have changed too. What we know now is that antibiotics, when they're taken too many times, the bacteria that travels among us develops a resistance to that medicine, and it doesn't work as well. And that's why a lot of patients, when they go to hospitals, they develop something called MRSA, which is an infection that is very difficult to treat with the antibiotics that we now have. And so we have been asked as a community of healthcare professionals to reduce the prescriptions of amoxicillin or clindamycin to our patients when they do not have systemic symptoms of an infection. And what that means is a fever, malaise, the shakes. Do not prescribe antibiotics unless you actually see the symptoms of an active infection. Now, what we also see in patients is that sometimes they'll come in with a toothache and the infection is in the tooth. It's not in the body, it's in the tooth. But if you give them antibiotics, even though the science tells us that that does not treat the infection that's inside the tooth, it actually works as placebo effect, meaning that just believing in the fact that you're taking medicine that's going to help you is actually helping you. We also know that in other countries, they have reduced the frequency of prescribing antibiotics, especially in Europe. And as they reduce the frequency of prescribing antibiotics, what they also saw is a reduction in the resistance of the bacteria that travels among us. And so now in those countries, they are less likely to develop infections like MRSA. So when you come and see me specifically, you may hear me talk about not prescribing antibiotics unless they are absolutely necessary. I hope that makes sense.